Bismillahirrahmanirrahim. Today, the topic which we are going to discuss are gingival sulcus, sulcular epithelium, probing depth, and junctional epithelium. What is a gingival sulcus? Gingival sulcus is a small natural space between the tooth surface and the inner wall of the gingiva gum. It is like a tiny groove or pocket around each tooth. In a healthy mouth, the sulcus is 1 to 3 millimeter deep. It is filled with gingival cervical clavicular fluid, which helps clean the area and fight bacteria. The function of gingival sulcus is to protect the tooth and wash away harmful bacteria. Its clinical importance is that if bacteria accumulates, the sulcus becomes deeper. So, if it is not washed and cleaned up properly, it forms a periodontal pocket, which is a sign of periodontal disease. This is a gingival sulcus, this is tooth, and this is a gum, and this is a gingival sulcus. Now, let's come to sulcular epithelium. This is a sulcular epithelium, B. Sulcular epithelium is a thin layer of tissue that lines the gingival sulcus. It is a non-keratinized epithelium. It is softer and more delicate than the outer oral epithelium. It forms the inner wall of the sulcus, the side which touches the tooth. It extends from the coronal part of the junctional epithelium up to the free gingival margin. This is the gingival epithelium. Wait. This is the junctional epithelium, and this is the free gingival margin, and between this is a sulcular epithelium. It does not normally attach to the tooth, it simply lines the sulcus. Because it is non-keratinized, it is more permeable, allowing fluids and immune cells to pass through. This helps defend against bacteria. Its clinical importance is that due to its permeability, it is the first line of defense, but it also is more prone to inflammation. Inflammation of gingiva is known as gingivitis. In a disease, it can change, thicken, or become ulcerated. Enamel, dentine, enamel, tooth structure. This is olar circular epithelium. These are the parts of gingiva. This is the junctional epithelium. The epithelium of gingiva is half oral circular epithelium and half is junctional epithelium. These are the periodontal ligaments which attach to the bone. Now, what is probing depth? Probing depth is the measurement of the depth of gingival sulcus or periodontal pocket using a periodontal probe. That is the depth of gingival sulcus. If it is normal, it is a normal depth of gingival sulcus, and if it is deep, it becomes a periodontal pocket, which is a sign of a periodontal disease. It is measured from the gingival margin to the base of sulcus or pocket. A healthy sulcus measures 1 to 3 millimeters. A depth greater than 3 millimeters usually indicates gingival inflammation or periodontal disease. How is probing depth measured? There's a periodontal probe, like William probes. It is gently inserted between the tooth and gum until slight resistance is felt at the base of pocket. That slight resistance is junctional epithelium. The reading on the probe shows the probing depth. What is the role of probing depth in periodontium? Probing depth is one of the most important clinical parameters in diagnosing periodontal health and disease. It detects gingival inflammation. It also measures periodontal pocket formation. Swollen gingiva increases sulcus depth from 1 to 3 mm to 4.4 to 5 mm even without bone loss. This helps identify gingivitis. A pocket depth greater than 4 mm may indicate attachment loss and periodontitis. It also elevates periodontal disease severity. 1 to 3 mm is healthy, 4 to 5 is mild periodontitis, 6 to 7 mm is moderate periodontitis, and 7 plus millimeter is severe disease. It helps assess treatment needs. Higher probing depth is equals to more advanced disease, and that means it needs scaling plus root planning or even surgery. It monitors healing after treatment. After treatment, probing depth should decrease as inflammation reduces and tissues heal. It also predicts tooth prognosis. If the top pockets are deep, the accumulation of bacteria will be more, attachment loss will be more, and the tooth prognosis will be poorer. It guides maintenance and recalls intervals. Deeper pockets need frequent periodontal maintenance. In simple word, probing depth tells us how deep the space is between gum and tooth. The deeper it is, the more severe the gum disease. What are the causes of increased probing depth? Now, the probing depth can increase for two major reasons: pseudopockets, no attachment loss, When there's no attachment loss, it can be gingival inflammation, gingival enlargement, or hormonal changes. They form pseudo pockets. A gingival sulcus becomes deeper because the gum swell or enlarges, not because the bone or attachment is lost. Now, in gingival inflammation or edema, swollen gums are swollen due to plaque, gingivitis, or irritation. Sulcus becomes deeper even though attachment is normal. And gingival enlargement, that is hyperplasia of gums, which it is actually caused by drugs such as phenytoin, which is used for epilepsy, cyclosporin, which is an immunosuppressant, and nifedipine or calcium channel blockers, which are given to heart patients. And gums overgrow, and thus the probing depth is increased. Probing depth can also be increased due to pregnancy, puberty. They form false deep pockets. Now, what are true periodontal pockets? True periodontal pockets are formed when there is true attachment loss. Depth increases because the junctional epithelium migrates apically and bone is lost. Periodontal disease destroy fibers and bones. Pocket becomes deeper. As bone moves downward, the pocket deepens, seen in chronic or aggressive periodontitis. Deep, narrow pockets due to specific bone destruction patterns can result in vertical or angular bone defects. There can be trauma from occlusion, excessive biting force, and there due to tooth malposition or crowding, the cleaning becomes difficult and plaque accumulates and pockets are formed. Now, what are the local factors that increases depth? Calculus, overhanging restorations, smoking, systemic diseases. Calculus traps bacteria, inflammation occurs, and pockets deepen. If the restorations are not properly finished, the margins trap plaque and periodontal tissue destroys. Smoking reduces blood supply and it also accelerates deeper bone loss. Systemic diseases such as diabetes or any disease which can compromise immune system, it results to faster progression of periodontal pockets. In short, probing depth increases either because the gum enlarges, which is pseudo pocket, or because the attachment and bone are lost, which is true periodontal pocket. This is the diagram of the sulcular epithelium, and this is a gingival sulcus. All around is gingival sulcus, not just on the apical portion, all around the tooth. Now, what is junctional epithelium? Junctional epithelium is a specialized delicate epithelium that attaches the gingiva to the tooth surface. It forms the base of gingival sulcus. It is considered one of the most important structures in periodontium. It is located at the cemento-navel junction. It forms the epithelial attachment to the tooth. The structure is it is non-keratinized epithelium. It is soft and easily permeable. It becomes thinner with age. Junctional epithelium attaches to the tooth by hemidesmosomes, demosomes, internal basal lamina. This attachment creates a seal around the tooth. What are the functions of junctional epithelium? It acts as a protective seal. It allows movement of immune cells. It helps maintain periodontal health. It's the first line of defense. It forms the base of the sulcus. It defines where probing stops. Early site of periodontal breakdown disease. Junctional epithelium is clinically important because it moves apically when the periodontal breakdown starts, and it is easily damaged by plaque. Inflammation begins at this area, and it helps to determine probe depth also. And it regenerates quickly, so it is useful in healing after periodontal therapy. Junctional epithelium is the layer that sticks the gums to the tooth and protects the underlying tissue. If it gets damaged or moves downward, gum diseases progresses. So we need to take care of our gum and oral health. That's a picture which shows dentogingival junction. This is tooth lines, and this is a gingiva. 1, 2, 3. Number 1 is junctional epithelium. Number 2 is sulcular epithelium. Number 3 is oral epithelium. This all is gingiva. Now, the junctional epithelium functions are attachment to tooth, barrier, rapid turnover, antimicrobial defense, and gingival clavicular fluid flow. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.